Hello scholars, my name is Dr. Kiris Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click that subscribe button and like button so I can continue to make videos. Now in our last video we covered social anxiety disorder, and in this video we're going to be covering panic disorder. So let's begin. Have you ever had a panic attack? Panic attacks can be really uncomfortable. It can feel as though your heart is beating out of your chest and that you can't breathe. Time seems to stand still, and sometimes it feels like you're coming right out of your skin. So, how do you know then whether or not you have panic disorder if you've had panic attacks? Well, here are the criteria for panic disorder. A. An individual with panic disorder has panic attacks that occur over and over again. A panic attack happens pretty suddenly as the individual experiences intense anxiety or fear, which is very uncomfortable for the person. The attack will usually get to its worst within a couple of minutes, and here are the potential symptoms. So 1, a pounding heart, and the beats will tend to go much faster than is expected or normal for the individual. Number 2, uncontrollable sweating. Number 3, uncontrollable shaking. So sometimes the sweating and the shaking will go hand in hand. Number 4, feeling like you can't breathe. Number 5, you feel like you can't swallow or that someone is choking you. Number 6, your stomach might feel uncomfortable. You might have nausea or feel like you're going to throw up. Number 7, you might feel as though you're going to faint. Your legs could feel wobbly underneath you. You might even ask to sit down. Number 8, you could feel like your body is on fire, like every extremity is on fire, your face is on fire, top of your head, or you might feel chilly or cold. And you might even have both kind of happening either at the same time or at different times. Number 9, there might be a tingling sensation in different parts of your body or a numbness that's present. Number 10, you might feel like you're outside of your body, kind of a depersonalization, or that you don't have any control over what your body may do. Number 11, you might feel like you're going crazy, that you're losing your mind. You might feel like you need to go to the ER because something's happening that you can't control. Number 12, you might feel like you're going to die, that you're going to stop breathing or that your heart's going to stop. So B, one of the panic attacks within 1 month is followed by one or more of these 4 symptoms. Number 1, the individual worries about having another panic attack or having its symptoms. Number 2, the individual behaves in a way that they think they'll be able to avoid having another panic attack. Number 3, the distress of having another panic attack does not come from the effect or the side effects of a drug or another mental condition. Number 4, the distress is not better explained through another mental disorder. Individuals with panic attacks do not tend to experience a pattern with their panic attacks. Having one panic attack a week is considered moderate panic disorder versus having them daily, which is considered more severe. There are some people that have panic attacks and then not having again for months at a time. Panic attacks that are called expected panic attacks happen because there is a cue or a trigger for them. So let's say a person has a specific phobia about monkeys and they go to a zoo and they of course see the monkeys there and have a panic attack. This would be called an expected panic attack. A panic attack that happens out of nowhere is known as an unexpected panic attack. Now 50% of panic attacks can be either or, expected or unexpected within the United States. So apparently we keep track of the type of panic attack that people are having. Neither type of panic attack means the person does or does not have panic disorder. It just goes back to the symptoms and whether or not they can check the boxes of the symptoms. There are also panic attacks that occur during sleep. This means when a person wakes up during sleep and has a panic attack, even during the course of sleep and then into an awakened state, they can have those. That is perfectly normal. Usually people with panic disorder have bouts where they are very worried about having panic attacks, and it's normal for these individuals to experience different times during the day where they'll experience anxiety because of that. Some persons with panic disorder do not like the side effects of various medications, and so they may have anxiety or even have a panic attack because of those side effects. Those persons with panic disorder sometimes will feel better if they carry medications with them for their panic attacks. And sometimes that mere presence of that medication can help them feel more comfortable. Others can be restrictive about the food that they eat and whether or not they feel that food will bring on a panic attack. In Europe and the United States, it's estimated that about 2 to 3% of individuals are diagnosed with a panic disorder. Females are diagnosed with panic disorder much more than males are at a rate of 2 to 1. This can be seen when females hit the age of 14 years old. The average age, though, that panic disorder tends to occur is from 20 to 24 years old. Usually a person with this disorder tends to have other anxiety disorders, which are usually depressive or a substance use disorder. Having a panic disorder is rare in children, but it definitely exists. If a child ends up with it in adolescence, this is usually accompanied by depression or substance use disorder. Panic attacks seem to lessen with age unless the individual is worried about a medical procedure or has a medical condition that could bring about death. The risk of panic disorder can be higher for individuals that have experienced physical or sexual abuse as children. Smoking is another risk factor for developing panic disorder. Many individuals that are diagnosed with panic disorder talk about a host of stressful events that help to bring about those panic attacks. It is unknown whether or not there's a genetic link for panic disorder, but professionals are pretty positive there's a link given heredity. There is definitely a risk for children of those individuals that have depressive disorder, bipolar disorder, or anxiety disorders to have panic disorder. And then asthma is also related to those that tend to be diagnosed with panic disorder. Individuals with panic disorder have a higher risk for suicide than the general public. This risk becomes higher if the individual has a past history of sexual or physical abuse, as we discussed before. Individuals with panic disorder tend to take off days from work or school much more often than the general public. This can lead to unemployment or failure in schools. They also tend to use the ER quite often, which can lead to increased medical bills. Okay, well, that is the end of our video. I just want to point out that if you know someone or you yourself suffer with panic attacks or even have panic disorder, please know that you are not alone in that. And that is not something that you need to feel ashamed of or embarrassed about. There are tons of other people out there that have anxiety disorders such as phobic disorder or panic disorder. So please, there's a lot of help out there for that too. Even therapy. Therapy helps quite a few people a year, as well as there are medications for people that suffer from that as well. You just got to kind of choose the route that works best for you and not be critical of others that take a different route with that. So with that, I want to thank you so much for being a part of this channel. I really enjoy doing these. I hope that this is helping everybody out there, whether or not you're just listening to these to know more about mental health and mental disorders, or if you're using it to study for something in the health field. Maybe you're even educating, which would be wonderful. Thank you for everything you do, and I hope everybody has a great day, and I will talk with you soon.